Pericardial mesothelioma is an aggressive and rare form of cancer that develops in the sac-like membrane surrounding the heart called the pericardium. Due to its uncommon nature, there is no universally agreed upon standard of care for pericardial mesothelioma treatment. Treatment approaches are often personalized based on various factors such as the stage and location of the cancer, overall health status of the patient, and patient preferences. The main treatment options include surgery, radiation therapy, chemotherapy, and targeted therapy. Surgery is often the first-line treatment approach if the cancer is localized and potentially resectable. The main type of surgery is a pericardiectomy, which aims to remove as much of the tumor as possible from the pericardium. For resectable tumors that have not spread outside of the pericardium, a complete pericardiectomy may be curative. Since pericardial mesothelioma often invades surrounding structures like the heart or diaphragm, a complete resection can be difficult to achieve. In such cases where negative margins cannot be obtained, surgery may still provide palliative benefits by relieving symptoms from tumor bulk. Even with an incomplete resection, multimodality therapy with chemotherapy and radiation can help improve outcomes. For unresectable tumors, surgery may be performed to take biopsy samples for diagnosis and install a catheter to deliver regional chemotherapy directly to the tumor site. Radiation therapy can be used both as a primary treatment and adjuvant therapy after surgery to help destroy any remaining cancer cells. For pericardial mesothelioma, radiation is usually delivered internally through brachytherapy via catheter placement during surgery or externally through intensity-modulated radiation therapy, IMRT, or proton beam therapy. Studies have found radiation therapy improves local control of the cancer and may help relieve symptoms. Common side effects can include fatigue, skin irritation in the treated area, and heart injury like pericarditis and myocarditis in rare cases. Chemotherapy is an important non-surgical option, especially for unresectable or metastatic disease. Platinum-based doublet regimens containing cisplatin or carboplatin with pemetrexed are usually first-line treatments. Other chemo drugs occasionally used include raltetrexte, gemcitabine, and doxorubicin. Chemotherapy may help shrink tumors, delay disease progression, and improve survival when combined with radiation. For regional delivery, chemotherapeutic agents can be instilled directly into the pleural cavity through a catheter for greater efficacy with fewer systemic side effects. Overall response rates to chemotherapy range widely, from 25 to 50% depending on various prognostic factors. Common chemo side effects like nausea, fatigue, and hair loss require careful management. Recently, targeted drug therapies are being studied for pericardial mesothelioma treatment. Angiogenesis inhibitors that block new blood vessel formation like bevacizumab have shown initial promise. Immunotherapies designed to activate the immune system against cancer cells, such as anti-PD-1 drugs pembrolizumab and nivolumab, are underway in clinical trials. Vascular disrupting agents like fosbutamine that selectively damage existing tumor blood vessels are another potential targeted approach. Other novel therapies being explored include inhibitors of growth factor pathways like EGFR, BIAC/AKT/mTOR, and hedgehog signaling. Multi-kinase inhibitors blocking several targets simultaneously may also benefit some patients. For most favorable prognosis and longest survival, a multidisciplinary treatment approach combining maximal tumor resection via complete pericardiectomy along with chemotherapy and radiation is recommended when possible based on stage and fitness. Palliative care aiming to relieve symptoms and maximize quality of life plays an important supportive role throughout treatment and end-of-life care. Clinical trials testing new therapies should be considered for all eligible patients given the rarity and poor prognosis of pericardial mesothelioma. An individualized strategy incorporating prognosis factors, anticipated benefits and harms of each modality is ideal for appropriate management of this challenging cancer. Treatment options for pericardial mesothelioma are multimodal but still challenging due to its aggressiveness and anatomy. An organ-sparing complete surgical resection provides the best chance for cure if feasible, but often multimodality therapy with chemotherapy and radiation is necessary for local control. Emerging targeted drugs and immunotherapies hold promise, but more research is urgently required to improve outcomes for this rare and fatal cancer affecting the pericardium.